Good evening, friends. It's my proud privilege as Secretary General of CAHO to welcome all of you to this very interesting and important webinar that we are going to be listening to today on PROMs, Patient-Reported Outcome Measures, the tool to evaluate patient care from the patient perspective. It's going to be a very interesting webinar, I'm sure, because the speaker is not new to us. Many of us who started our journey in quality have Dr. Malathi as our guru. She is indeed the guru of quality management, and she's taught several of us. In fact, my first lesson on key performance indicators, I really learned from Dr. Malathi when she came for assessment to the Christian Medical College, Vellore. So many of us owe a lot to the contributions of Dr. Malathi, and it's indeed a great privilege to have her with us. She's a wonderful teacher. And the way she teaches from basics to the most difficult topic, I'm sure you will all, go through that experience today. So let me take this opportunity to formally welcome and introduce to you Dr. Malathi A. She is the Group Chief Medical Officer, Group Chief Quality Officer at Aster DM Healthcare, a multinational healthcare organization with operations in India and GCC countries. She is responsible for the management and leadership oversight of medical services and quality improvement programs designed to promote clinical excellence across the verticals. She is the chairperson of various scientific committees at Aster DM. She has extensive experience facilitating interdisciplinary teams to improve the quality of care. Dr. Malathi has been instrumental in establishing a culture that prioritizes patient safety, resulting in highly dependable systems and exceptional clinical outcomes on par with national and international standards. She leads the strategic clinical projects, physician engagement and improvement related to large multi-site quality improvement initiatives, including accreditations, the NABH JCI Accreditation Canada, and the adoption of electronic medical records. In the past, she served as Medical Director and Chief Quality Officer for the Manipal Group of Hospitals, India, and she is a member of the Accreditation Board of ACHS and Accreditation Canada. She's got excellent experience in all verticals, and above all this, I would say she's a very passionate teacher and a trainer. And honestly, ma'am, I think many of us are really excited and waiting to listen to you. So I don't want to stand between you and the audience. So over to you, Malathi ma'am. We are waiting.
Let me start off with something which is very, very close to all of us. And even when you heard the anthem, it was all about patient safety. It was everything related to patient care, patient-centric. Friends, the time has come now where we have to look at everything from a patient's perspective. Over the years, we have been focusing a lot on clinical outcomes, feedback from patients, which are very, very important. But we have to take a small step back and think, what does the patient think about us? What does the patient say about the quality care that we provide? And needless to say, that is what is going to decide as to whether we are delivering what we are supposed to deliver. And that brings us to the title of my today's presentation, and that is PROM, the importance of patient-reported outcome measures. So let's take the next about 30 minutes or so to see what the patient is looking for and how do you find that out. So that brings me to the first thing, why? Because before we start on embarking into any journey, it's very, very important for us to answer some simple questions. That is, what are these PROMs? Why are they being used? And what are they used for? To answer these, let me start with two important aspects. One, the PRO, and the other, the PROM. What is PRO? What is PROM? Patient-reported outcomes, simple, is PRO, and they are outcomes which are known to the patient. This is available within the patient, and patient knows every aspect of it. And what is PROM then? The same is being measured, and we use tools for it to measure what is the patient thinking about us, about our outcomes and our care. And that becomes patient reported outcome measures, which are nothing but the tools that we use to measure the patient outcomes. That is next. Admire this particular statement, which says outcomes remain the ultimate validators of the effectiveness and the quality of medical care. Unless you measure the outcomes, you will never be able to monitor. And if you do not monitor, you cannot improve. And therefore, that brings us first saying quality is always measured by the receiver and not the provider. However, we might say that I'm rendering a great service, which is good to be confident, good to be proud, but the person who tells us whether you have done a great job has to be the receiver. And in our healthcare, who is the receiver? The patient. So it's very, very important and the need of the hour to find out what does your patient say about the service that you have rendered. Therefore, quality is measured from a receiver's perspective and not from the provider. And if quality is a part and a soul and the heart of everything that we do, we need to understand it from a patient's perspective, who happens to be the receiver. The effectiveness of that care that you have provided is measured by what we call basically as the most important today's topic, the patient reported outcome measures. So today's topic is all about what does a patient say to us about the care that you provide. Brings us to the second question. What are they used for? And very interestingly, the measurement of the health status of the patient or the health quality of life, we provide care, we provide interventions to the patient. But when you measure it from a patient's perspective, what is their quality of life on basic what you have provided? That is what PROM is going to tell us. And as I proceed, I will be telling with each one of them, how is it being measured? It tells you an intervention. Angio is performed, plasty is done, TKR is done, THR has been done, so many procedures. At the end of it, what does the patient say about the outcome? Did it make a difference to the patient in terms of their quality of life? That is what ought to be measured. It could also be immediately after the surgery, maybe down the line after 3 months. What happened after 6 months? So at different intervals, you would like to know from the patient the health status. That is what you measure from PROM. And is it a best treatment? What do I mean by that? Very often, the treatment is rendered, and it is important to understand from the patient how much difference did it make to your lifestyle. It's a great input that comes back to the doctor whether it was the best treatment. And also sometimes there are differences in the population, and you find PROM measures the difference. And last but not the least, some are suitable for economic evaluation, quality adjusted life years. So these are some of the most important outcomes of using a PROM, and we will see how every aspect of it is being covered. In summary, the few slides that I talk to you now can be simply summarized by saying the patient-related outcomes, which means what are the symptoms of the patient, what has happened to his physical function, his emotional function, his attitude towards society. All of these are very important, but at the same time, what about the therapy that was given? Did it improve the outcome? Did the patient perceive it as an improvement? Did the patient feel that there was enough communication to take a choice? And did it improve the quality of the performance? All of these, in a nutshell, friends, is what the PRO instrument is going to do. The questionnaire voluntarily given by the patient, and it captures that data, which is extremely significant for us. With this, there are general methods we do collect information. Clinicians report information. We also have physiological. We take the various vitals. It's also an assessment. The caregiver tells us that I did this and this is the outcome that I have. My door to balloon time is this. Aspirin on arrival in a cardiology case is this. Great. From a caregiver's perspective. Today, we are looking at what does the patient say about our performance? What does the patient say? How is my functional status? How is my well-being? What happened to my symptoms? Am I able to carry on with the quality of life? How did I feel there was satisfaction? It's very important because finally, it is a patient who is in the center of our treatment. Don't we all owe it to the patient and get that data now from the patient? Yes, the door to balloon time is very important, but the patient says, fine, the door to balloon time was absolutely fantastic, maybe from your perspective, but my chest pain has not improved. Now it becomes important for us to look at it, and that's what I'm coming to say. What is the patient reported outcome and a clinician reported outcome? Patient related outcomes, inexpensive, captures the experience, a very, very important aspect because it is a patient who has to tell you whether you have done a great job. Flexible administration modes. I'll come to how you can administer, and you have excellent assessment methods. When it comes to clinician, it's more summative. It's a standardized process, evidence-based practice. Coming to what are the cons, we are very dependent. Remember, patient-reported outcome means your respondent burden is there, and making sure that the patients respond to you. There may be demographic challenges, different population. Finally, last but not the least, the patient may just refuse to respond. On the other hand, in the case of the clinician reported, there is a rater bias. The person performing it is giving you the data. There can be variability. And most important, it does not capture the patient's experience. Therefore, now let's start by looking at patient-reported outcome. How do we start? So I'm going to state the basics now of what we are going to look at. And what is the first thing that you need to look at? Each one of us, as experts, as people who are in the healthcare domain, must first identify what is it you want to measure from a patient's perspective. Very important. Have you made sure that it is important to the patient also? Because he will be or she will be interested in giving you an input, provided it is of significance. So that is what you need to first identify. The patient-reported outcome, what is it that you want to measure? Having said that, very important, you then identify the PROMs. I will be taking further, how do you identify the PROMs? Because they are all existing, and I'll tell you how do we go about it. When we say identify the PROM, we need to be very sure it is reliable, it is validated, responsiveness is accurate, and how easy it is to use. Each one of the characteristics are very important, and let's see later, how do I find that out? Last important is, once you have identified the outcome, you have identified what you want to measure. Later, as always, the patient-reported outcome performance has also to be measured. And that means you benchmark against the international and national standards. If there are any threats, remove them. Find out how much has been a missing. What is the poor response? All of these also you should always see, have we done the right job in using the right outcome? Simple example. Let me just explain this by saying, patient reported outcome. So what is an example here? Taken a simple one. This is a case of a psychiatrist in the hospital who says, I want to understand from a patient's perspective on a very important parameter, and that is feeling of depression. So he says, my outcome for me, which is important, and I would like to measure for my patient, is feeling depressed. Fine, we are ready with the first one. Now it comes to, how do I measure? And I know that this has to be reliable, validated, feasible, and therefore, what is this patient reported outcome measure? I go ahead and see there is an existing one which is called PHQ-9. Right now, just believe me about this. Later, you will understand about more and more details about it. But I could identify, the clinician works and identifies and says, this is exactly what I want to be measured. Therefore, choosing the right measure, choosing the right tool becomes extremely important. Having done this, now at the end of 6 months and using it on the patient, he says, I want to see how well have I done. Patient reported outcome performance. Did it do a good job? How do you measure? It is based upon, he says, I want a patient score of more than 9 by 3 weeks. If I find this, then I know that my line of treatment is fine, and was this able to measure? So that is a first step, baby step that we will take. Having done that, we said, how do you select your instrument? That means I know what I want to measure. I need to sit with a clinician and say, will this PROM respond to changes in the health status? Because he says, I would like to know over 1 week, over 2 weeks. I would like to know after a TKR, how much has he improved in terms of his mobility? So he says, I need a PROM which can measure this. So the instrument selection. The next very, very important, administration. How would I administer this? Because what is the overall burden on the patient and the clinician? Remember, this is respondent, important part of the entire exercises. It is totally dependent on the respondent. Therefore, if you are going to use a very elaborate one, there are excellent ones, 32 questions, 42 questions, 94 questions. Great. But will it be a burden to your patient? Then it's very important that you choose the right instrument. And last but not the least, what are the time points? Who is going to administer? How do we train them? How is the administration going to be done? Will it be a questionnaire? Will it be using a tablet, or there will be a QR code and he gets a feedback? How is it going to be administered? All of these have to be thought about, a planning. And finally, data analysis. Will the results generated has a statistical significance? Is it going to be meaningful? Is it going to be statistical as well as meaningful? All this, so all of us should understand, implementation of the PROM is great, wonderful to know a patient's perspective, but at the same time, a wrong tool could be a total waste of the time of the clinician, the patient, and particularly from a quality perspective, we may not be able to get the right data. Now, having said this, this is a very, very interesting graph. And if you see here, on one axis, you have the patient reported outcome. In this, say, quality of life is taken as an example. And when you say the patient keeps reporting and he finds fantastic difference to the treatment given, it goes to the other end. What does a clinician look at? Morbidity, mortality, and finally, no morbidity and mortality is very important from a clinical perspective. So we have a clinical outcome and you have a patient outcome. The best of your PROMs is one that will take into account both of these, and what we call at the ideal one, which is they go hand in hand. What does that mean? You move from the red circle of the patient and the clinician and start working towards This direction, which is what we call the two perspectives, should go together. And we will see how the PROMs are going to measure both of them. So, the next set of slides, friends, we all feel quite convinced, yes, we would like to measure from a patient's perspective. We all believe there are tools available. I need to take the right tool. Therefore, I am accepting the fact that I'm going to embark on the journey to implement PROM. I'm ready, and every institution feels, let me measure what the patient thinks about me. Therefore, what are my next steps? Very important. I'm reiterating this question because the success of the program depends on, does the PROM measure what you want to measure, and does it measure from a patient's perspective? If your answers are going to be yes to the patients, you are ready, then check the information that you're going to get and what you will not get from the PROM. So be very, very clear, because unless you know what you want to measure, you may not choose the right PROM. Therefore, the next thing that is important is choosing the right PROM. This is a question which generally a lot of people ask me and say, can we start using it? And I always say, before you start, please understand the implications of choosing the wrong PROM. First and foremost, you will fail to identify the outcome. It will mislead the clinical practice, because your outcome of your patient is what the clinician is looking for and making changes. So it will mislead the clinical practice and misrepresent the treatment and the disease. So all the three are very significant. Therefore, be careful when you choose the right PROM. Now, having agreed that yes, I'm ready and I want to choose the right form, so what are the things I look at? Characteristics of an ideal PROM. Number one, content. You should always make sure the questionnaire, the PROM that you're going to use, does it reflect what you want to measure? If it is going to be, let us say, a total knee replacement, and you want to understand from a patient's perspective, what is it you want? The patient must answer questions which are related to, say, pain, stiffness, properly measured. So, content validity, face validity. Do the individual items look as if they are going to measure, or are they sentences which are very ambiguous? So that means every statement should have the right scoring, easy scoring. It should not have a scale of 1 to 10 and the patient finds it extremely difficult. It could probably say, can you answer this yes or no, wherever possible? Or you will see in the later parts of the slide, I'm going to give you examples of those questions. Criteria, can it be measured accurately? There should be no ambiguity of the sentences which says, how do you feel? Now, that is a very subjective feeling, and you will never be able to analyze what the patient feels because perceptions differ. Therefore, make sure the validity is important and it is understandable. I've had the experience over the last almost 3 to 4 years we have been implemented. And at the end of it, many a times I have found that I did put the PROMs, but I didn't get what I wanted, not because the PROM tool was not good, but I found that the patient didn't understand what I was trying to ask them. And you will see in my examples that I give you shortly. Reliability. Keep a watch on your results, and is it the same over a period of time? Is it keeping on changing? Then what do I do? We have a solution for that as well. Precision. Very, very important. When especially you're going to compare between two groups of people, always make sure it can measure, discriminate between the patient groups. If you are trying to ascertain, is this treatment better than the other, from a patient's perspective, they should be able to measure the difference. So that is very important. Responsive, very, very important factor. Suppose you find that there are going to be changes over 2 months, maybe even after a bariatric surgery. You want to find out how is the patient feeling. 3 months, 6 months, 1 year? Is this going to make that change very clearly evident or not? That is to be answered. And what to measure may be obvious sometimes. Friends, very easy to ask about pain. What is your pain? How much is your pain score? It is easy. Sometimes it is not obvious, in which case you need to do a little literature, because there's a lot of work that has come and done on PROM, and take an expert opinion. And the best expert for you to choose your PROM is your clinician. He is the domain expert. He knows exactly what he wants to be measured. So always remember, PROM has to have a buy-in of your clinician. Then finally, you can have interviews, understand from them on and off whether they have understood, so that you are as close to an ideal PROM as possible. Therefore, how do we begin our journey now? And let's say we want to start a PROM. We start asking these questions. What will you want to measure? Very simple. What, therefore, the particular question should include? Immediately keep a checklist, sit together, brainstorm, sit with also ideally your clinician, quality team, all others who are involved in the delivery of care, and say, what is it that we want to define? What is the item that I want to select? Very important. Very, very important. Does it appear that it will measure? Is it going to take the patient experience? Suitability is very important. Does it measure? See, the points are very, very important. What about the scoring? How will it be done? Is my scoring going to add up correctly? What is the error accessibility that you will accept? Is it able to measure a change? Is it free from any bias? This will decide now. This questionnaire is slowly getting ready. What to measure, how to measure, suitability. This part is extremely important, because this is going to be the final structure. And last but not the least, very important, the questions are ready, but you might find this person does not understand the language that you are going to start. Appropriate translation methodology. Retranslate it. If it is from English to any language, again ask someone of that language, translate back, and then see. Suppose it is translated from an English to Malayalam. Someone from Malayalam should translate it again to English, and what you had in English should match what has been translated. Have new versions been tested? And keep looking at that, then you are sure to come to an ideal one. Will people accept it? Is there going to be a barrier? Am I sure I'll get good responses? Is there a problem with the item completion? Will they fill the entire? As I said, having a long questionnaire of about 32 points, fantastic. It will cover every aspect of the patient. But is it going to be completed? How many cases were getting missed out? Is it an evidence-based practice? All these thoughts should come into your mind, because remember, there's a lot of time, lot of energy that has to be invested. Finally, anything else? Yes. How easy is it going to be to administer? What is the cost? What is going to be the time? What is the ease of scoring? How do I interpret it? All of these, please look at it before we start with the PROM. Now, we have slowly got ready, but don't forget, there is a special consideration, especially when you take children, adolescents. Remember, those who cannot respond. It could be you want to check a pediatric group. You want to look at infants and see what is the PROM. It is possible, but encourage observation. And what is it that you can observe? These PROMs are very tricky, because you should take only those which can be observed, because it cannot be anything that the mother, the father, or any person do not observe. You can't measure it. So be careful on the PROMs. Patient's cognition. We encourage always include only those that can be observed, because there is a problem in cognitive deciphering here. Then you have to decide. And of course, there are cultural and language subgroups. Once all of these have been thought of completely, you are now ready, and then you will start now. The next journey begins. What type of prom can I choose? You have what are called as generic, and you also have specific. Generic would be where you can use it for most cases, comparison between different people, different illness, not sensitive to detecting specific diseases. This is called generic. You also have condition specific, which is to a particular disease. You will have a separate one for Parkinson's. You have a separate one for CABG patients, a separate one which is being used for neurological issues. Content is relevant to that target group. Some go for what is called as a combined. Some questions are generic, but some are very, very disease specific. You will see towards the end of my presentation, I will be giving you specific examples of each one of these. Very important. The last part that you must consider before you start is length. I'm reiterating this because we ourselves burnt our fingers when we started off very enthusiastically by having good questionnaire, very validated, 32 points were there, and it took and looked at every aspect of the patient requirement which they would answer. Slowly we found not even 20% of the questions were answered, because towards the end, they felt reluctant to answer. Therefore, length is very important. There are abridged versions and long versions. Please decide with your clinician which one do you want. These look like small issues, but please consider them. Even the font size. We realized that some were not answered because the font was so small that they skipped the questions. They said it was too stressful. New instructions for each time. Do not combine. We started looking at this or that. Now you do not know what is the answer about. Whenever you have patient, they have to look into a lot of their records. Now you will not find complete response. Straightforward, simple. When you embark on the journey, do not make it complicated where patient has to look back on various records and then answer them. It might give you good result, but incomplete. Privacy. Sometimes you might want them to answer. Give them a space. Let them sit somewhere and answer, or take it home. It's fine. Please do not include questions that by and large patients are unwilling to answer. You may put it up, but you will find you do not get any outcome. Patients will leave it blank. They may need physical help. Turning the pages looks all simple, but if it is just a one pager, no problem. They may say, I want to use a telephone. I might need a computer. Every aspect of it, it is nice, but you will, as we go along, we learn a lot as we start using the prompts. Before we start looking at the different forms, I would like to look at what do we measure. You might want to measure physical function. It depends. Now, if you are looking at orthopedics, for instance, very often you want to see the mobility, dexterity. You might like to know the activities of daily living, ability to eat, wash, etc. So it depends on what the clinician wants. Is he looking for physical function? Is he looking for symptoms wherein you might want to say, I want to a PROM which will cover pain, nausea, appetite, sleep. These are important to me. The symptoms, how they have improved from a patient's perspective. The clinician might say, no, mine is more on psychological. I would like to know the anxiety, the depression, the coping skill. So please ascertain what is it that you want to measure. This decides your content. Once you have done that, the next one is maybe social well-being. Generally, the psychiatrists, if they are using a PROM, go in for family and other intimate relations. Cognitive function, they would say the PROM should cover alertness, concentration, memory. There are lots of these. You need to write down. These are just simple examples I have given. Choose with the clinician which one is most important for him and go ahead with that. It could sometimes be activities. Might say that I want to know how the person feels because has he started working? Are there financial concerns? Satisfaction, because a person might say, I want a life satisfaction, and that might be the therapy he is undergoing. And finally, you might want to have a satisfaction with care. Once you know what you want to measure, it's very, very simple. I've given an example. Suppose I take up mobility. All I have to say, make it very simple and just say, I have no problem with walking. I have some problem with walking. I am confined to bed. Simple. There are no ambiguity. The patient says 1, 2, or 3. If it is self-care, for instance, you want to look at is a person able to take care of themselves, then the question can be, I have no problems with self-care. I have some problem washing or dressing. I am unable to wash or dress myself. So you can see here, whatever activity, whatever you want to measure, please measure it in the best, easiest form and make sure that you are taking it from a patient's perspective, not from your perspective or from anybody who's delivering the care. Because if you don't consider the patient, you will never get the right outcome because he will not understand what you want from him. Simple question of anxiety or depression. I am not anxious or I am not depressed. I'm moderately anxious, or says I'm extremely anxious. Simple. You will get what the patient has got from your treatment. Once you have decided the contents, friends, next is how do you score it? Scoring again, simple terms, make it as none, mild, moderate, severe, unbearable. Sometimes the scores which you would use in your PROM may be just 3 in number. It might be 4. When you choose your PROM, it will guide you which one you need to use. So you can choose the pain, you can choose functional, you may want to choose medication. You want to find out what happened to your medication. Are you taking more than 10 tablets? After the therapy, have you taken 6 to 9, 3 to 5? Very easy. They'll be able to tick and tell you, I was taking 10 tablets. Now I am taking 4. That itself tells you from a patient's perspective. Therefore, we are ready now, friends. We have got an idea what we want. We have an idea now what we want to measure. We also have got an idea about how the response is going to be. We know we can select the administration now and we start a pilot test. And that's where we embark now on our journey. And before that, I want to talk on one point, which is called recall. Very often, the questions which you will ask should be simple and depends upon the disease. Remember, it's easy when it is short recall. If you say, what happened today? What happened yesterday? What happened 1 month back? It's fine. But if you expect 3 months back what happened, you might find that your outcome that you get from your PROM may not be very accurate. So try and make sure that the recall period to the patient is as simple as possible whenever you're trying to ascertain. So that should be also considered. Now we are ready, friends. The next part of my presentation will be totally on the PROMs that can be used. Therefore, let me start by wishing all of us a good luck, and we say, now I have identified a good match. I found the right PROM and I say, no, then I have to do some work in it. I have to go back and say, this PROM is not good. I have to choose another one. Yes, I've chosen the right PROM. I have an accepted PROM. I will tell you this, all the varieties of PROM. And then I go to the next question. Is it easy to use? That means, is there a lot of burden of cost, too much of printing, literacy? If anything is a problem, I say, my God, this is going to be tough. Let me go back, choose another one. No, seems to be easy. I can put a QR code. There's no problem. I can give a tablet to the patient. I can ask him a Google one to be given, and the person can go and answer later. Everything is done. Yes, ready. Fine, fine. Go to the next step, and here will be the scoring. Very, very important. How is your scoring? It's making sense? No, the score seemed to be very ambiguous. Go back, change your PROM. Now you feel the scoring is simple, pain score, no pain, slightly moderated, or you're using a VAS scale, very easy, valid, great, yes. Next, you look at your patients. Can it evaluate a change in a group of patients? Small changes might happen. Clinician might want to know the change. Does it answer? Yes, you are ready. No, it's not going to tell me. Change your PROM. Last but not the least, can it define important responses? You want to know mobility. You want to know pain. You want to know stiffness. You want to know whether there is angina. Any one of these very, very important responses. Is it measuring? Yes. You are now ready. You made the right choice of your PROM. Once you have done this, now you start administration. You say, is the patient going to do it themselves? Are you going to administer it? Are you going to use paper pencil? Are you starting electronic? Is it going to be telephonic? Is it an interviewer administered? All of these are all your choice, which makes it easy and the cost is taken care of. And then you are ready to start. I'm going to give a small model. And here, what am I going to measure? Patient response. I have sat with the concerned doctor, and the person concerned rheumatologist says, I want to know about his swollen joints. I want to know about the tenderness of the joint. These are extremely important for me. I said, fine. If you need to know about these two, how would you want it to be measured? And he says, I would like to know this, and they may not be able to measure the swollen joint. Tell me, is it become big? Is it become small? It's very, very subjective. That's not where I want. But he says, yes, I can know from the pain. I will also know from his movements. Is he getting tired? Because there is pain, he will definitely have sleep problems. He says, can your PROM take care of these? Well said. Okay, we will look at it. And then, furthermore, if I want to look at fatigue, pain, I then say, should we measure mobility so that I get to know when he's walking, is a pain there? In his physical activities, is he getting tired? I said, can we measure these two? The clinician says, absolutely. I would like mobility. I would like the range of movement. And further, I go on further and say, social activities, yes, because his quality of life is affected. If he is going to be in a nagging pain all the time, emotion is affected. So he says, if you can have all of these in a questionnaire, I would like it to be measured. And then I go measure, look at it, and I find the quality of living questionnaire is the PROM, which is a validated tool available. And you will see going through this quality of life, it encompasses every aspect that the doctor wants. And then you say, yes, I have found the right PROM. And that is how you start doing these small little diagrams. What is the treatment? What is the symptom? What is the assessment you want? What are the concepts? So this is a similar one, but what I explained to you earlier. Now, friends, we are coming to a very, very important and probably the last part of my presentation, which tells you sample tools. They are all available, but the most important is, how do you choose them? That is what I talk to you all this time, that the choice depends upon yourself and the clinicians. You, when I say the quality, and the rest of the team working with the clinicians and says, here is an orthopedic person who says that please measure for me everything related to the arm, shoulder, and hand. And you say, here is a dash. That is a PROM available. But going through this dash, you find it has got 33 questions. Is this possible to answer? Therefore, you say, let's go to quick dash. There is something where the doctor says, I want the patient's perception on my wrist surgery done. The other person says, I have another patient-related outcome measurement. I want this information. You can see here specific Oxford elbow, Oxford shoulder, Oxford hip, Oxford knee, knee society score, shoulder function score. These are very, very few. There are hundreds of them, validated, reliable, ones available. I've just given you an example how you can choose from. And if you saw the quality of life, there is European quality of life 5-dimension. You have a visual analog scale. These are subjective areas that you want to measure. You have to make the right choice. Having said that, you can see a simple example. Here, patient reported outcome was to be measured because there was severe shoulder pain. And we said, let's take it on a pain numeric scale. Shoulder function, we took up Oxford. You will see that some of the examples I'll be showing you how we have used this and got the result. So these are already ready available and you need to choose the right one. Having said that, some are very easy. They like to use these pictures. In fact, these are very well accepted. To give a simple example, this is a questionnaire where we say, for each question, please tick in the one box that describes your answer. And we say, answer the question as you feel. There is nothing right, nothing wrong. And all that you say is, how much are you currently affected by pain? And it says not at all. So it says the pictures are also there. So you will be able to get the right feeling of the patient. If you do not put those pictures and still ask them, you might get it, but it will never be as easy as when you have these pictures because it says pain or discomfort and it's a very subjective feeling. What about your other symptoms? See, is your mood affected? Not at all, slightly. So these pictures help. How much does your physical or mental health prevent you from enjoying your life, doing your normal activity? Again, pictures help you. How worried are you? A very difficult question to answer. And if I were to just say, how worried are you of your health and put yes or no, a large chunk you will miss out. Therefore, you want to say, after the therapy that has been given, the psychologist, psychiatrist would like to know simply more relevantly and are your symptoms indicates that you have undetected any illness. This is one form which is available, which is a patient quality of care. You need to, let me give you example and come to the final part before I give you actual implementation. There have been a lot of studies that have been done, friends. Cancer care. And what was the background? Oncology clinic. They introduced PROMs to assess the impact of cancer treatment. What was the outcome? Because everything was done by the patient. Patient perceived, patient spoke, patient said, how do I feel about it? Whatever therapy you are giving me. What was the outcome? Early detection of side effect. The clinician did feel this was fantastic and was supposed to be giving, but they were able to detect the side effect through the PROM and improve the symptom management. What was the outcome? 15% decrease in hospital readmissions. Remember, we as quality professional cannot say PROM is good and then say we did the PROM. We should be able to say that with the introduction of the PROM, what difference did it make to the care of the patient? This is another very interesting study. Mental health using PROM. What did they discuss? They found that psychological distress was identified, which they had never ever thought about it. They had just put them on treatment to a set of patients. Patients who had a PROM quickly came back and told them 25% reduction in reported anxiety. How did we achieve this? We didn't do much. It was the patient who told us that please help me. This is a history of a chronic disease management, primary care setup, introduction of PROMs, overall health was seen, preventive care, and what did they find? 30% decrease in hospitalization because they were able to see how the preventive care was making a difference. Very common, rheumatoid arthritis, painful. Patients who have this really go through a pain and they feel, I wish my life would end. Hospital implemented this for arthritis. Excellent physical communication was the outcome of the PROM. 20% reduction in pain levels and, of course, satisfaction. So this is to tell you, why do we have to embark? Why is it important in this era? The last but not the least, always be open for the change. Never ever introduce a PROM and say, I'm done with it. This shall be the PROM used in this hospital forever and ever. Never. Always remember to go through these important points. If you find your PROM, I put in highlight, if somebody keeps asking you clarification, keeps coming from the patients for the question, time to change. If you find some of the responses are not being answered at all, and you find some of them have got yes, some of them practically no, there is a lot of distribution crisis, change. If you find all the patients give the same answer to a particular question after a period of time, means either delete it, you're not going to get any information, or change. So we need to be very, very cautious. Very, very important. Items highly correlated. You find you're asking the same question and the patient does not understand why is it being repeated. Redundant. Remove it. Item is not at all sensitive. The patient says, yes, but I can't make out any difference because I don't know. I just do not understand this. It means he's not able to detect a change. The question is irrelevant. Very, very important. Item duplication. Just by having more number of questions doesn't mean that the PROM is excellent. Redundancy. And always recall them. If they are not good, please recall and reinstitute. That is why I said recall, period. Never have questions asking a patient, what do you think was the status 6 months back? Patients don't even remember 24 hours back. So this becomes a waste. This will be the last of my slides to tell you about PROMs. And it looks a little, I would say, very, very congested. But I want you to understand, just as you want to find out about PROM, patient has a right to tell you whether your PROM was acceptable to them. Percent response to patient reported outcome question. Very interesting. See the question. It says, questions were easy to understand. And you find that strongly disagree, agree, and it is nice to see 63 plus 34. This is a survey which was done, and it was good to know that almost 97% people said it is easy to understand. They found the questions useful. It's important, again, good percentage, but also be cautious. Suddenly you've moved into 13%. Some of them, 13%, felt it doesn't seem to be useful to me. I would like to continue this system, which tells me about how I am doing. Good, again. The system of answering improved my communication with my doctor. Good to know that. This system made me feel more control of my own care. I felt it was participative, but very, very important is this question. That's why I brought number 3 down here and said, how much do these questions help your physician understand your current health? And again, it was good to see the different areas that you can see here. Agreed, strongly agreed, this person becoming high. So friends, it's important to ask the patient, how useful was your PROM? If a patient perceives that this questionnaire is not of any use to me in improving my care, change or delete that particular questions. Now, I'm going to the last part of mine, and that is from our experience. We have learned a lot. We have a long way to go. But only thing we can say is that we have actually done a number of them, felt they were not good. The big advantage probably we had is our whole lot of 40 to 45 hospitals in our chain in India, in the GCC countries. So whenever we put forth a PROM, We try to do it as much as possible at both the geographies, in many of the hospitals, wherever that is a scope of service, and try to understand what was their experience, because that tells me the geography difference. My Oman experience will be different from my Saudi difference different from Dubai different from Kerala different from my Maharashtra hospital, different from probably Karnataka. Sometimes it may not be, but a wide variety, and we all sit together and analyze what we get. So some details I'd like to take you through is some of these, as you will see here, which we have worked on. This is generally the QR code that we use so that patients can just scan it. And we find that the best way to do it is keep this QR code in the patient, in the consultant's chamber. After he finishes the consultation, the therapy, or the treatment, or the procedure, he just requests the patient and says, "Can you scan this, please?" Everybody has a mobile. They can scan it and enter it, and it is voluntary. But it's always a word that comes from the clinician who says, "It will be good because it will tell me how am I doing." You are going to ascertain how my particular therapy has been. Therefore, if you tell me how have I treated you, it will help me to improve the way I need to look at your symptoms. So with that, let me look at what did we do. So this is a PROM. The PROM is called as the birth satisfaction scale. And we said we will do this for all our normal vaginal deliveries. And we looked at only 3 aspects. What is the quality of care? What was the attributes? I'll tell you what it means. And what is the stress during labor? Needless to say, it is a stressful experience, but we would call it as a pleasurable stress. And therefore, you can see quality of care, self-attribute, and stress. And when you look at quality of care, I'm just giving you one example. I will not put in all the questions, but this was interesting. The quality of care was measured by these simple questions. I came through childbirth virtually unscathed. I was not in distress all during the labor. I thought my labor was excessively long. So you can see that simple, something that they experience. Self attributes. The delivery room staff encouraged me how I wanted to progress. I felt supported. They communicated with me. Very hygiene and clean. The labor room. This is attribute. And finally, what happened during labor? I felt very anxious. I was out of control. A very distressing experience. And interestingly, we did analyze it and see what happened to the scores, the stress which was being experienced, because they are 2 different hospitals, and one of them had this as a score and the other one as 40. In fact, the lower the score, the better. And now we are trying to look at and see maybe the number of primary people who gave us stress was much more. We are going to analyze and see maybe we have to do a little expectation management if it's a primary gravida. Maybe a multigravida knows about it and therefore the stress was not very high. We are also introducing certain programs like Nurture, Blossom. These are to help people during the antenatal period. And we are now going to see, now that we have a baseline data, giving this particular experience and training antenatal period, is it going to make a difference in the way they perceive? So this is the birth satisfaction, and it is more or less done across all our hospitals in both all the geographies. This is another one that we had taken up, and this is orthopedic. What is it used for? Now, the earlier one was an experiential PROM. This one is used to measure the outcome. And here you will see here, what does it measure? So we chose this. The question, why? Because what they felt was very important was stiffness, pain, and daily living. That was what was important for knee replacement. There is a methodology on how to score it. You sum up all the scores, and it is from this, it keeps telling you all this is already validated tool. It tells you from the score, this is your interval score. Why is that important? Now you will see. This interval score, you can see baseline, pre-operative, before the person underwent a TKR. The person's score was baseline, post-operative 6 weeks. 0 represents total knee disability. 100 represents perfect knee health. And that was what was basically found out from this interval score. That means that all the scores get totaled. From that totaling, you get the interval score and you know where you stand. Like this is about 56.7 was the score. Attribute, straightforward, tells you about stiffness, pain, and function of daily living. Higher the attribute score, worse are your symptoms. So hospital A and hospital B have done this, and we have looked at what has been the score. This is another very interesting one that we applied, gastroesophageal reflux. And the clinician wanted to study again an outcome and said, my questionnaire should be able to tell me how often did you have a feeling behind your breastbone? Very important. How often did you have your stomach contents moving up? See the language, that is extremely important. How often did you have pain in the center of the upper stomach? How did you ascertain your nausea? Did you get a good night's sleep? Because why? Most of these people will have regurgitation. If he is able to tell me about the sleep, that itself is important. How did you take any additional medication for this? Then you put a pre-post. And what do you see at the end of it? This is done, therefore, fundoplication surgery, pre-surgery, post-surgery. The total score ranges from 0 to 18. Higher the score, worse are the symptoms. So this is what we say, PROM to study outcome. Similarly, this is another case where it is a very, very interesting study, and this is used widely in a number of hospitals. We use it as well, which is called the Oxford Knee Score, which is called OKS. This is Oxford Knee Score, and please see this is called functional score. That means it will tell you all about how the patient is going to feel. So you call it as Oxford Knee Score, related questions that will speak about patient's perspective of the outcome following a total knee arthroplasty. That is what is called as Oxford Knee Score. But we also have another score which is called Knee Society Score. This is KSS. Interestingly, I want people to look at KSS observation, KSS functional. Now, the moment you see observational, the questionnaire has got elements where the physician has to answer. There are elements where the patient has to answer. So the patient will also be answering, and the clinician will answer from a symptom perspective. Symptom-wise, he might say on examining, everything was fantastic. But when you look at the functional score, if that does not tally with it, it's a lot of information that goes back to the clinician. So that is why this particular Knee Society score becomes important. And then you will see, this is Oxford score, just simple 12 questions. It tells you knee function and plane, very practical question. Each of them has a score 1 to 4, and therefore you can get a maximum of 48 because 4 is the maximum. And then you get what is called as OKS functional score. Whereas another one which you have, it is patient and there is observational data, and from then you'll be able to get. So we always write this pre-op, how many underwent this, and post-op, interestingly, which sometimes does not happen, at the end of 6 months and 1 year also, some of them have completed, it has been 100%. Probably the patient-doctor communication strengthens this. This is another one that can be used very well. It is called for hip replacement, called the HOOS. Higher the score, better the outcome. And this is what we have seen. It evaluates simple. We never went into great depths. We thought what is important from a patient's perspective? The pain on the hip joint, functions? How is he able to carry on with the daily life? What is the quality of life? So the questions again are very, very simple question. I'm just giving examples of the different departments. This has been done extensively in our hospitals, which have cardiology department. And there they look at the Seattle Angina Questionnaire, which is called SAQ, and the dyspnea scale, which is the RDS. Again, lower percentage at 1 year, good outcome. And there you see here. This one is the Rose dyspnea scale, physical limitations, and angina symptoms. What happened at this point at admission and 1 year, and very, very simple score. The Seattle Angina Questionnaire has question number 1, which will only ask on physical limitation, because one thing which occurs with cardiac patient is their inability to continue with work. Second and third questions, there are only 4 questions. Second and third asks about chest pain, discomfort, any area where you feel there is tightening of the chest. Whereas question 4 is your quality of life. How self-confident do you feel? There are patients who say, I almost hold the heart every time I go around. This is the quality of life that they talk about. The percentage, of course, the scoring is all very, very clearly given. And this is how I've just thought an example, again, crowded, don't worry about it. This is how, see, the questionnaire looks like. And they are very, very simple ways to answer. Choose them. Walking indoors, gardening, lifting. It only tells you what was your chest pain. How did you feel? Did you have to take tablets to bring the chest pain down? What did you do that was limiting your enjoyment in life? This is all is SAQ. The dyspnea, I did not have any dyspnea, only when I'm hurrying, only when I'm walking with people, only when walking at my own space on level ground, when washing or dressing. This is your dyspnea scale. And the patient would answer and tell us whether they are doing well. So this is a similar one on another set of patients that were saying. I'm going to come to now, outcome measurements were done. This is a PROM which is used to plan the care. Little different, but PROM which is used for it is called as IPSS, International Prostate Symptom Score, PROM used for it in prostatic patients. And what did the clinician do? These are the attributes which are measured in the question, and it is brought out into, scoring is totaled, and the end of it, it will tell you, is it mild, is it moderate, severe. Where does PROM come in the picture here? Patient answers and says, therefore, clinician plans and says, if you belong to this category, let me start with conservative management, lifestyle modification. If you belong to this, let me start with medication and this. If you're severe, let me start with medication and surgery. This is participative decision making, and that is how PROM is used as a tool, not only to measure the outcome, identify satisfaction, to plan the care. This probably is going to be my last of the PROMs which we have been using, even used in the outpatients departments. This is done at our outpatient clinic. You have an allergy clinic where we use what is called a SNOT. And this is particularly used for chronic rhinosinusitis. First visit, 6 weeks. What happened? Patients visiting vertigo clinic, they use what is called dizziness handicap PROM, pre and post. And in addition to this, you have a headache impact test score where they answer questions on whether it is impacting the headache. Is it impacting their role, their vitality, cognitive, psychological? They are all evaluated. They get their score. Accordingly, they undergo treatment. Did it make a decrease in the impact? How are they able to lead their life? So these are all the PROMs available. It is for us to choose which is the PROM. For what do you want to measure? Do you want to just see how the care has been given? Do you want to measure an outcome? Do you want to plan the treatment? And that brings us to the end of my presentation by saying, first, quality is never an accident. It is always the result of intelligent effort, as given by John Ruskin. And here I'd like to tell you, intelligent effort in this context is understanding quality and outcome from a patient's perspective. And that is what is important in the present era, because the patient has to be understood as whether he got the right care. Thank you.
That was brilliant, Malathi ma'am. Participants, didn't I tell you? She will mesmerize. And let me tell you, such a topic, a very complex one. I don't think anyone can do justice the way you have done, Malathi ma'am. Lot of questions answered. And, you know, we in India have been struggling with this PROMs and of course the PREMs ever since it became a requirement in the NABH 5th edition. None of us actually had clarity on what we were talking about. What are the PROMs to use? The importance of PROMs. And it's been amazing listening to you. And you really simplified the whole concept. I don't see questions at all. It's all about brilliant session. Look at all the comments that are coming there. It's all, you know, excellent, brilliant. And we have a very nice comment by Mahesh who says, nice content and must-see lecture for all the professionals. We truly appreciate you for taking your time, for making it so simple. And with your permission, can we go ahead and share the slide with all our participants, ma'am? Because that's something that's coming up on and on.
Absolutely. I think everything of this is supposed to be sharing. And unless you share with as many people, we will never grow. That's what is important, because what I'm looking at is not only looking at this, but asking them to try their own PROMs and share that with us. Because the more we use these PROMs, the more the tool becomes validated. And some of the hospitals, when they use it, they can come out and say, this is what we found as a problem. This is what we validated. So we don't have to reinvent the wheel. And therefore, we would be able to have it across all hospitals, share with them and say, every one of you, we have made it sort of mandated. I would say I've done it that every hospital should try at least 3 PROMs of the 3 departments to start. Then you cultivate, increase it, start doing it. Because at the end of it, our care has to be decided by our patients. That's important. So long we used to always talk about clinical outcomes, which are very important. But I always tell my clinicians now, the patient will decide your angiogram and angioplasty. I'm going to compare your door to balloon, your door to imaging for your stroke patients, and let my stroke patients say it was fantastic. And let the stroke patient say that my quality of life has improved. I can't be happy by saying my door to imaging time was exactly 1 hour. Fantastic. But at the end, if his quality of life has not improved, I still have not achieved what I'm supposed to do in healthcare. So I think all of us, the very fact that you've organized a PROM and a PREM shows the passion that we all have. And I'm sure working together, it is possible. Thank you.
Exactly. It's all about the collective synergy to simplify, not to reinvent the wheel, but all of us working together. For want of time, let me take one question, ma'am. What is the best time to provide PROM questionnaire to the patient? So do you think it is immediately after discharge? Is it specific to that tool? What is your experience?
Usually it is quite specific to the tool. Many of them, the clinicians, as I said, we usually ask clinicians to do. I totally say that PROM is as a buy-in of clinicians. We tried initially, why I'm saying this, initially we had quality department doing. As usual, anything you start, the first people who will be asked to do it will be quality. It was very tough because they thought it was another feedback. You already have half a dozen feedback. Service excellence will have a feedback. You will have nursing having that feedback. So the patients, the moment they see the quality person approaching them, forget about even doing anything, they have already gone out of that place. So Anna is giving a big broad smile because I know that she would feel the same. So we said no. That is why I said we in fact have kept a tent in the consulting room of the doctors. And in that, the QR code is already kept over there. So as soon as he finishes, the clinician says, I have done this. So can you please scan this? Take your time. Please answer it. It is going to come directly to me and it will help me to change your line of treatment. This has got a very, very specific interest to the patient, because patient feels that, okay, the therapy is going to be modified depending on what I tell him. So that is why I said this is a very participative decision tool. And we have all moved into earlier where the doctor says, and then the patient has to follow. We now ask, even in consent, everywhere we say, did he explain the alternate line of treatment? That means it has to be participative. So here the patient participates and the patient then comes back and say, yes, this improved, but I didn't do so well on this. So the doctor immediately says, okay, let me modulate it for you. Maybe for others it worked. So I feel it is nothing of a definite time, Lallu, to put it. I would say it should be done based upon when they have given a treatment. Yes, if it is a TK or a THR, you definitely have to wait after the surgery is done, because he is going to tell you, and it is very clear. You're going to do it on the 3rd day, you're going to do it on the 6th month. So it is all fixed. It has to be after the intervention. But if it is for, like I gave you the example of IPSS, which is prostate, you have to do it. And now it's very nice to tell them, you say that you are mild. That is why I'm going to try this line of treatment. So you can imagine how the patient feels. It is so scientific. It is not that the doctor wants to take a knife and start off. Sometimes patient feel is always waiting to pounce on in taking me to the operation theater. I've got lots of complaints where they say they didn't even allow me to think. But here, he says very clearly, I find you are only moderate. Let me try out for you medication and lifestyle modification. Let's do, please give back information how you feel. If it has become better, very good. You have gone from moderate to mild. If it is worsened, we always can do surgery. There's no problem. So you can imagine how convinced a patient can be in a scientific manner. So to your question, Lallu, it all depends upon what is a PROM you're measuring. If it is for pre-therapy, is it for post-therapy, or is it at that time you want to understand? So it is given at that time, unlike where feedback you wait and see after discharge. It is not that way. It is totally depend upon customized to that.
Thank you. Thank you so much, ma'am. And I am going to take the liberty and ask you to lead the PROMs initiative for CAHO, because this is a resource limited setting and it is for us to actually validate, make sure that, and CAHO has the bandwidth with member hospitals today. If we are in a position to validate very simple context specific PROMs, I think we are going to be doing a lot of work with our patients, and this is going to benefit the overall patient outcomes, the engagement with the patients. So if you agree that you can lead this initiative, Malathi ma'am, we'll be excited and we'll be extremely happy. No one else can do justice, Malathi ma'am.
Yeah, thank you. But your last statement, I wouldn't agree that nobody else would do. There are lots of people who would do it. That's fine. But happy to form a team, because these are things which have to be a team. So there are lots of people who are actually very, very passionate. My own team has lots of people who are good at it. So we could have from various hospitals people who would be happy to join. The more the people, ideas become much better. They become streamlined. I always believe that you should just keep yourself open, listen to everybody. And because even one person's you do not listen a voice properly, you would have lost something great. So let's form a task force and probably roll out small numbers to begin with. Let's not try big things. Simple question is, which are validated tools already? We don't have to be pioneers to start something, and then we find it very difficult to validate the tools. So let's try and use those which are validated content, whether it is a small hospital or a big hospital. It should be possible to use by both. You cannot eliminate and say, small hospital, it is difficult, the number of questions are more. No, let's bring the questions down to what is the right number. That is more important. It's not the number. And happy to work with the team and carry on with this and make sure that we have this instituted in our hospitals.
Thank you.
Sure.
Brilliant.
Thank you.
Thank you very much, Malati ma'am. And on behalf of Kaho, I really would like to place on appreciation, the level of knowledge sharing. And certainly many people have commented here. And I think you should go through all the comments. You're going to be very happy. A great teacher always. That's the comment I like the most because I endorse that certainly. Thank you once again, dear participants. As mentioned in the previous webinar that we had on PROMs, we've already initiated validating 20 PROMs. So we have formed the teams that are looking into surgical safety, endoscopy safety, dialysis, anesthesia, infection prevention, wound care, medication safety, antenatal care, transfusion safety, discharge process, radiation safety, MRI safety. And if any of you feel that you could contribute to this exercise and want to participate in these exercises, please feel free to write to office@kaho.in. And the presentation made today by Dr. Malati will be shared with all of you. The recording will also be shared with all of you. So thank you once again, everyone, for joining this wonderful session and look forward to meeting all of you very soon. Thank you, Malati ma'am.